Welcome to Vision Center's podcast, where we dive into the captivating world of eye care and vision health. I'm your host, Alex, alongside my co-host, Jordan. Each episode, we explore the fascinating realm of vision, bringing you expert insights, the latest advancements in the field, and actionable advice to take care of your sight. So sit back, relax, and let's open our eyes to the world of vision. Welcome back to the Vision Center's podcast. Today, we're diving deep into children's vision, specifically amblyopia, often referred to as lazy eye. I'm excited to have with us today's guest, Jordan, an expert in eye care. Jordan, can you tell us what amblyopia is?
Sure, Alex, and it's great to be here. Amblyopia, or lazy eye, is the most common type of vision impairment in children. Simply put, it's the improper visual development of one eye early in life. The brain favors one eye, and over time, that results in the other eye's vision getting worse.
Interesting. Are there different types of lazy eye?
Absolutely, there are three main types. The most prevalent is strabismic amblyopia, where the eyes aren't aligned due to a muscle imbalance. Then there's refractive amblyopia, which is often due to farsightedness or other refractive errors. Lastly, deprivation amblyopia is usually the most severe type. This occurs when a problem in one eye, like a cataract, impairs its vision.
Wow, that's quite a variety, but how does this condition develop?
Great question, Alex. Lazy eye can develop when there's interference with normal vision during a child's development. For example, certain refractive errors, physical eye problems, or even childhood strabismus can lead to amblyopia.
So it seems critical to diagnose this condition early on, right?
Absolutely. Early diagnosis is key to successful treatment. That's why all children should have a vision screening by their 4th birthday.
Can you briefly touch on the symptoms?
Sure, common signs might include squinting, crossed eyes, a droopy eyelid, or your child bumping into objects. However, it's often difficult to notice these, and many times parents aren't aware their child has amblyopia until a doctor diagnoses it during an eye exam.
Thanks for that, Jordan. Coming over to treatment, could you elaborate?
Treatment involves addressing the underlying eye problem and training the lazy eye to develop normally. Corrective lenses, surgery, eye patches, and eye exercises are some of the treatment options.
What's the outlook for a child diagnosed with amblyopia?
The sooner the treatment begins, the better. Without treatment, a lazy eye can worsen and may even lead to permanent vision loss. Treatment before age 8 is necessary to provide the best chances of preserving a child's vision.
This is a wealth of information, Jordan. Can this condition be prevented?
Yes, some lazy eyes are preventable. For instance, if your child has strabismus or a structural eye problem, it can be treated before it leads to amblyopia. Also, treatments like eye drops or patches can strengthen the weaker eye.
That's comforting to know. Thanks a lot, Jordan, for this enlightening discussion. I believe this information will be quite useful for all our listeners out there.
My pleasure, Alex. Like with any medical condition, knowledge is power, and I'm glad I could contribute today. Thanks for having me.
Absolutely. Knowledge indeed is power. Thank you all for tuning in. Keep an eye out for our next Vision Center's podcast. And that wraps up another enlightening episode of Vision Center's podcast. We hope you've enjoyed our discussion and found some valuable takeaways to help maintain your vision health.